factory one district approach? Is it a way for women in Galamsey to be out and also benefit for this intervention?
Thank you, Mr. Chair. Thank you for the question. Mr. Chairman, in the first place, the constitutional duty of a deputy minister, it's stated clearly that I am there to assist my minister. And I thank my God for giving me Dr. Kwekufri as my minister, because he has been my mentor in the region. He's somebody who really is very, very pleasant to be with. And I know I'm really going to have somebody to work with to my satisfaction. My minister outlined, when he came before this honorable committee, outlined how we're going to tackle this Galamsey issue. And just as you said, the women are also there as well as the men. But it looks as if we are always talking about men and leaving the women out, just as the Bible. In fact, in Ghana, we know that even in this world, it's a man's world. But with my minister, we are going to sit down and discuss the issue thoroughly and then ensure that they lay down procedures. In fact, it is a problem for the whole country. And there should be a dialogue with stakeholders. Then we'll look for answers to solve these problems. Because once you bring them out to this one district, one factory, come and work in any factory, and they don't get what they want, they may go back. But when there are opportunities from them, for them to develop better, I think that I will really talk about it. And I know that my minister being here shows that he supports me. We discuss the issue and then take our sisters and our brothers and the children out of this situation. Thank you.
My last question is about women in sex trade in mining areas. The question has been asked when your minister was here. But this time I'm talking about the elderly women. You know them. You know where they are in Takwa. We call them Mami I Come. They are tired, old. They no longer attract the market, not attractive on the market. But they need help. You know, I've seen all these things when I was working, preventing sexually transmitted diseases among them. That was the project I was working in. What comes into your mind immediately as a form of support? You know, they are very, very poor, elderly, and we need to target them as well. For the younger ones, the roamers, you know, they ply between circle. When they hear about the bonuses, they follow to Takwa. When there is bonus in Obuasi, they follow to Obuasi. So they are very well placed, I may say. So I'm worried about my elderly women who should also have a living at this time. Thank you.
Thank you, Mr. Chairman. Mr. Chairman, this trade has been with us, in fact, even though some of us were not born. But one thing that I know is that women are very, very vulnerable. Sometimes, if the ends cannot meet, people resort to all sorts of ways to find something on the table. So such women, they need to be talked to. It's advocacy. But sometimes, too, it's very difficult to talk somebody out of what he's been doing all along. He's used to. But I think that it takes one person to be able to convince somebody to get out of something that is not good for the person's health. We would institute these, we work with NGOs. They are already there, and we need to work with them. We need to go to the bottom of it. We cannot allow them to be there forever. So that we should find a way of doing it. And I think that if they have children or they don't have children, or some of them are even widows, they've been asked to leave their homes and all that, I think we have to go into the bottom of why they are there. That is where we'll be able to take them out of what that trade. And even the younger ones, not only old women. If some people have done it and they are old, the younger ones can also be talked out. So I know that we would constitute a team to ensure that we give them enough education to bring them out of the situation. Thank you.
Honorable Barbara Asha Ayisi.
Thank you very much, Mr. Chair, and congrats.
You are aspiring deputy something.
And congratulations, Ms. Gifty Kusi. We're so proud of you. My question is quite similar to what Honorable Dr. Halu asked on sex trade, prostitution. My concern is with the younger ones. I have engaged some of them, and some are into prostitution, not because they want to be there, but some because of the situation, the economic hardships, have to actually go in there to become breadwinners. Some are taking care of their families, their mothers. They have to go and take care of the home. As a woman, I know that may not be your major role, but as a woman and going to occupy such a prestigious position, do you have plans for such women who could have done something with their lives? Any plans for such women into prostitution in the Western region, to be specific?
Thank you very much, Mr. Chairman. Mr. Chairman, unfortunately, I've had a study into this aspect of a problem that we are discussing. We put some women to learn some trade. They were in the business, so we were able to bring them out. And then some of them went to hairdressing, some of them went to dressmaking. And I tell you, they are no longer there. They are making it. They've left there, but one went back. So all that I'm saying is that you have to go into why they are there. You cannot just go in and say, I'm bringing you jobs, I'm doing this. If you don't study their situation, you may bring them and they will go back. So the first thing we need is data. Why are you there? What can we do to help? So advocacy is number one. And then number two, you have to know their background. Why? Before you be able to help somebody, you have to know why the person is doing this. So I have plans. But as I said, those plans that I have, I'll have to discuss and then get approval. And I know that I'll get it. Thank you.
Chairman, so we've listened to the nominee, advocacy, data. Beyond that, what will you do?
Thank you. Beyond that, the trade itself, you see, I have an experience that I want to share. There were people that a mining company were trying to get them out of a place because it was nearer the mining, and they were blasting and things and dust. So I just designed a questionnaire. They said they were waiting for their money. They are not leaving. So I designed a questionnaire. Do you know the health implication, the social implication? When you go there, when you even get this money, you will even take you to hospital to go and cure your diseases. Immediately, they started packing. So, Mr. Chairman, you see, when somebody is in any situation, and then you know why he's there, the problem is half solved. Then you go into the person's background. Before you have role models, you teach them the skills and everything. But if they do not want to go, then you need to do extra job by trying to be with them, live as them, be a participant observer, and then you get them to leave. Thank you.
Thank you very much. I think today is Women's Affair, and we're all concerned about what happens to the woman. I'm looking at teenage pregnancy. And looking at your CV, you've done a lot on that. You did a study, you were a resource person. When there was a program dubbed Study in Teenage Pregnancy and Drug Abuse, and some other interesting programs. What do you think you can do to help curb teenage pregnancy in Western region? Thank you.
Thank you very much. Teenage pregnancy, we all see this picture around us every day. Young girls who are disadvantaged, and sometimes they come from broken homes. Few of them come from homes which they could have taken advantage, but they didn't. Mr. Chairman, for teenagers, you really have to live like them, be like them, and then know them before you be able to get into them. If you just go there trying to condemn them, you are not going to get them. So I think that, one, we should try as much as to do a lot of education, health education, contraceptive usage. I'm a health professional, and I think that if we teach them how to go, those who want to do it, the thing is ABC, abstain. And then if you can't abstain, then you have to go to the C. You have to use contraceptive. Whether we like it or not, our children are sexually active. Their parents can be whoever. They are sexually active. So I think that we should go be with them, teach them, talk to them, and then talk to the men as well. We try to only blame the ladies, but the men who do it, the boys, should also be involved. Thank you.
Chairman, the men who do it. I heard. So the men, you stand accused. Chairman, mine would be two brief questions. With your experience in Parliament, there is a public interest in Parliament becoming more open and more transparent. Which aspects of our standing orders would you want to see improve to achieve that public interest object?
Thank you, Mr. Chairman. Mr. Chairman, transparency in Parliament. One thing that I noticed is that the citizenry are just not interested in the work of Parliament. Because everybody can come to Parliament. Everybody can come to sit in the gallery. And the other papers are distributed. If you want any information, you can get it. So, Mr. Speaker, sometimes even if there's anything before a committee and you want to know, you write a memo and the committee is there to listen to you, to tell you why we are doing this or what's the implication. So I think that we should educate the citizens more on Parliament, because as far as I'm concerned, there's transparency. Especially any issue that comes on the floor, it's discussed on the floor of the House. So anybody who is interested will know. So I think that the education has not gone down. The other time I was buying a mobile credit, somebody just said, MP wants to talk credit. People don't even think that we buy credit. You should buy, I'm no longer an MP. But the issue is, we should really educate people on what Parliament does. Thank you.
Chairman, my last would be, I see a lot of managed aggression in the woman seeking to serve Western region. But you have a very calm minister of Dr. So it will be aggression plus aggression. Oh, not when he's looking for a seat. When he's looking for a seat, he'll be aggressive. I'm talking of administration and governance and also into research like you. What assurance can you give this committee that the people of Western region are sure of a twin partnership that can only inure to the good of the people of Western region, and that tomorrow we will not be hearing conflicts, counter-conflicts, tensions, differences between minister and probably with DCA? Just an assurance to our committee. Thank you, Chairman.
Mr. Chairman, thank you very much for the question. I assure you with all, I promise on my honor. Mr. Chairman, my minister is cool and collected. And as I said in the beginning, he's very, very pleasant to be with. So just as to any two people staying anywhere, you cannot pretend to be angels. I am prepared. Gifty Eugenia Kusi. I'm prepared to work cordially, which you will never hear. If there's anything, it will just be between the two of us because we've already bonded. Thank you.
Honorable Election.
Thank you very much, Mr. Chairman. First of all, let me congratulate when I was chairman for the Health Committee, she was a member, very active member. But my question is, you see, these days we have had series of reports of suicide cases. And if you take the statistics, they are alarming. You have worked with the Health Committee actively to pass this bill on mental health. Now, what will be your advice as to how we can handle the suicide cases because of your research background, particularly with young women?
Thank you, Mr. Chairman. Mr. Chairman, I think in the first place, the amount of money going into the mental health department should be increased for them to be able to work to the full benefit of their capacities. And I also suggest that universities should expand their counseling departments for especially young people, even not the universities. We should also get training colleges. I know there are counselors attached to most of these institutions, but their departments should be strengthened. And they should really get into the day-to-day activities of the students. We should not only expect students to come to us in the department that, or maybe somebody reports that this person is quiet, this person doesn't come to. We should look out for them so that we'll be able to nip the problems in the bud. And I think counseling services should be improved in all institutions, in everywhere. Even the markets should have counseling units where individuals can visit from time to time. And I think we should train more. I did some psychology in the university, and I think that we need a lot of, some of them do not even have work to do. And I think we should set up these units to really catch them before they go off. So I think that in the first place, we should increase this mental health budget should be increased to be able to train, build people's capacities for us to get to where those people are. Thank you.
Chairman, thank you. Fortunately, you are going to the Western region, and we already have a doctor, a medical doctor, as regional minister. You also know the contents of the Mental Health Act, and the purpose for passing that act was to ensure that we mainstream mental health into the general health situation of Ghana. You already mentioned the fact that there is a need to increase resources to that sector. But as a former member of the Health Committee, what will you do in the Western region to ensure that, as in the Act, each of the district hospitals, including any specialized hospital, there is a ward for mental health patients, so that they are not mixed up with people, but they should be attended to just like any physical health problem? What will you do for us to remember you as having worked collaboratively with your medical doctor as regional minister? Thank you.
Thank you very much. Mr. Chairman, this issue should be really taken seriously, because I think that if every ward, every hospital, every institution is given this privilege, we really get somewhere with the solution of these problems. The Speaker, my minister is a doctor, as you said, and together we will start implementing this thing in our region. And I know he agrees. In fact, he's all for that. Thank you. He's told me.
Honorable Munchaka.
Thank you, Mr. Chairman. Honorable Eugene, congratulations. She served with me on the Health Committee, on the Mines and Energy Committee, and then on the Business Committee. I can see the Northern Command, part of the Northern Command are behind her. Congratulations. In the answer to the question earlier, you know that when we were on the Health Committee, we were doing the Mental Health Act. We were told that for every four people that you meet, at least you are likely to have one of them having mental issues. You can see around this table, we are more than 12 feeling that at least there's at least some three or four. At least. Because, I mean, you see the way we all laugh about it, but you agree with me that it's not everybody who is well-dressed and looking healthy is somebody that you can say he or she doesn't have a mental problem. And sometimes by the time you realize it gets out of hand. You remember that when we were doing the Mental Health Act, it was said that all the mental health institutions that we have were in the South. They were in the South. And the act, we tried to liberalize so that it can be spread across the whole country. Now, looking at the stretch of Western region, from Takoradi all the way to Adabokrum and the rest, what do you think you will do together with your minister to spread, like my colleague earlier asked, to be able to make provision for people to assess at the very early stage cure for mental challenges?
Thank you, Mr. Chairman. Mr. Chairman, we already have health institutions in these areas that you are talking about. And we are also, as a nation, the CHIPS compound issue is getting on, and we are establishing these small clinics. So I think that the best we will do is to ensure that most of the institutions that do not have will get, and those that we try to establish will also have those departments so that we get it closer to the people. Thank you.
Thank you, Mr. Chairman. Mr. Chairman, you know one of the major challenges that we have is within the health sector workers. There are very few that have specialized in mental health, psychology, and what have you. There are a number of nursing training colleges within your region. What will you do to encourage the study of many nurses and other allied health professionals into the mental health area?
Thank you, Mr. Chairman. Mr. Chairman, the training of nurses in this nursing training, most of them do this subject. And you have some of them having interest. So I think that particularly we have to ensure that we entertain them, we try and identify them, and then with the establishment of these units, for them to man it, and then we get a lot of people to be in that field. The nurses in the training colleges, we have to go there and do advocacy. Try and educate them, the need for some of them to specialize in this training, and we'll get people to do that job for us. Thank you.
Will you suggest to your regional minister giving some scholarship package for persons who want to go into these areas, this specialized area of studies, just to be able to help us with the mental patients?
You see, our position in the regions is that we need to collaborate with the sector ministries so that when scholarships are being offered, training abroad or training within Ghana, we'll get our quota. And then from there, we'll sit down and see that, oh, we need to take this number of students through this so that we balance it up. We cannot only look at only one aspect of, because you know that health is universal. So we really sit down and discuss the issues and know how many will go each year. Thank you.